So the process of figuring out if you have prostate cancer can be a little extensive. So there are many symptoms of prostate cancer, and if you're experiencing these, your doctor can do these through a number of tests. One of these is a blood test, and it's a prostate-specific test, and it tests the pressure, the PSI levels within your prostate. And they can do some other tests to find out if you have any other cancer through these results as well. And just because you have some of these symptoms doesn't necessarily mean that you have cancer. And you might not be able to determine whether it is truly cancerous if you're experiencing all the symptoms, and even if the blood test does come back. So remember to discuss things with your doctor and discuss the results to make sure you have a definitive answer. There's also another test called a trisectal ultrasound, and it is going to do an ultrasound on the prostate. During this procedure, the doctor will go through the rectum and use a scope, and then of course the ultrasound will produce a photo of the prostate to be able to identify cancer. There are also further tests that your doctor can use. One of these is putting a endoscope needle through the penis. This goes through the penis and through the bladder. And they will do a rectal biopsy, and they will go through the rectum, and they will take a small sample biopsy of the prostate, and then this will be analyzed to determine whether or not it is cancerous. And if the biopsy test comes back as cancerous, there are some other tests that you can do, such as CT scans, and you can determine whether or not it is going to spread throughout the rest of your body. So some of the things that you can do with your experience of having prostate cancer is to stop it from spreading to the rest of your body. And some of these symptoms that you can notice are if it runs in your family, your age, and different risk factors such as that. One of the biggest helps to cancer is just removing it altogether. One of these options is surgery, and so one of the problems with this surgery is that you will experience not being able to control your bowel movements. It can make it hard to get an erection. It can cause erectile dysfunction. And this happens when we perform the surgery of the prostate being removed. And hopefully after surgery, the erectile dysfunction should discontinue, but if it continues, be sure to talk to your doctor. Another important factor about this surgery of getting your prostate removed is that you can no longer have children. So if you want to father any children, you might need to ask your doctor about sperm banks or opportunities of saving your sperm to be able to father children in the future. So another treatment that they use is high energy frequency, and it has the same long-term effects, trouble with the bladder, erections, that can cause UTIs. It can cause infections as well. These symptoms can also be related to other problems. When you have the prostate removed, they may also have an imbalance of hormones because they remove the male testicles. So you might have to take medicine if you are having issues with the balance of your male hormones. And the testicles themselves make most of the male chemicals throughout the entire body. So this medicine is really important to protect yourself from any hormonal imbalance, and it will in fact help your reproductive system as a whole. If you're feeling faint and having issues with getting an erection, if your bones are weak, if you're just having a lesser desire of sex, if you're having diarrhea, it is really important to watch these symptoms because your doctor will be able to advise you as to how he or she can best, improve your health. If you have other serious health problems, or you're over the age of 60, or you have a family history of prostate cancer, it's really important to let your doctor know, and it's very, very important to not procrastinate. So most cancer, when found early, can be stopped. The easiest way to do this is to do this ahead of time. So it's important that you eat healthy in order to protect yourself against getting different kinds of cancer. So most types of cancer tend to grow very slowly. So if they are found early, then treatment is a lot more successful. And many different treatments might be offered by your doctor. But one of the best things you can do is create healthy eating habits. If you do have cancer, try to limit your stress. It's really important to deal with processing time and just to think positive. Remember that you have a support system, so share your concerns with maybe your friends and family who you are close with. And if you know that there's going to be treatments and whatnot, be sure that you're contacting your support groups and contacting your family and friends and staying connected. Also, if you need, try to